What is skin tightening? Skin tightening is when you're bulk dermally heating the dermis, which creates a dermal wound, and that dermal wounding leads to new collagen growth, aka collaneogenesis, as well as collagen contraction of current collagen fibers. And both of these two things lead to tissue tightening. Specifically speaking, a dermal wound is when bulk heating and maintenance of 43 degrees C in the dermal layer denatures triple helix protein bonds that hold collagen fibers together and elastin fibers, and that creates spacing disruption, and that spacing and disruption stimulates three main things to the site of dermal wounding: white blood cells, stem cells, and fibroblast cells. And for our sake of conversation, we'll focus on the fibroblast cells, which are responsible for collaneogenesis, the growth of new collagen to fill in the gaps from that dermal wounding and spacing that was created from the bulk heating. Also, the heating causes contraction of current collagen fibers, and again, the skin comes back tighter. Throughout the course of skin tightening, technologies that first started in the market were stampers. And when you're stamping heat, you have to use extra high peak temperature because heat scatters and reflects. And when you're stamping and moving from one spot to the other, you have to use extra high peak temperatures to have the tissue retain heat. And the problem with that is that it's very painful to the patient. You get a lot of heterogeneous heating. So when you look at fluid camera thermal imaging profiles, you see hot spots and cold spots. And so more recently to the market, over the last 3 to 5 years, we've seen technologies come out to be movers, where we're moving the heat and painting the heat with comfortable energy settings. And not only is that more comfortable for the patient to elongate the treatment time to get the best maintenance of 43 degrees C, it also allows for us to get nice coalescent homogeneous heating. So when we look at thermal imaging profiles via fluid cameras, we're able to see nice uniform heating throughout the tissue. Here is taking a look at an animated sagittal view talking to the physics of Forma and FormaPlus. In the middle of the application, you can see positive, blunt, flat RF pins, and to the outside you see two negative electrode rails, making up for bipolar radio frequency. Each positive pin delivers an RF current in both directions, and the distance between the positive charge pin to the outside negative electrode rail correlates to the depth of all those electrical RF currents that you see in the image. The further the distance, the deeper the currents. The closer the distance, the shallower the currents. And so with that being said, the specific physics array designed on the Forma application is 2.5 to 4 millimeters. So we're precisely bulk heating and selectively heating the dermal layer. In the FormaPlus application, it's a larger footprint, a larger spot size handpiece, and thus the distances between all positive pins to outside negative electrode rails is deeper, and the specific physics array designed on that applicator allows for us to heat up 4.5 to 6 millimeters on body areas where we have a thicker skin and thicker dermis. Here's what really separates Forma and FormaPlus from all other skin tightening technologies in the marketplace. And in order to explain the features and benefits of our ACE technology, I must first draw upon what other technologies have had to do, whether they were stampers and movers, throughout the course of skin tightening. We know the goal and objective when you skin tighten via all the peer-reviewed studies that have been out for the last 10-15 years is to maintain 43 degrees C in the dermal layer for an extended period of time to get the most optimal denaturization, again breaking down those triple helix protein bonds that hold collagen and elastin fibers together, in order to get the most impact of our dermal wound, and thus the most optimal fibroblast cell stimulation to the site of spacing and dermal wounding to get the most optimal collaneogenesis, new production of collagen. Well, the reality is that there has been no technology that really has mastered the maintenance and extension of heat at 43 degrees C. And the way it really has worked up until our technology is that you have to sort of heat the skin and rely on your primitive eyes only to say, okay, the skin's looking a little bit too red, it might be burning the skin. And then hinder from your treatment, stop your treatment, pull out an infrared temperature gun, which they sell at Home Depot, really designed to measure meat temperature when you're grilling. You have to pull that thermometer out, check the skin temperature, and then once you know you're safe, start the treatment again. Well, there's two main problems with that. First, the skin temperature is dropping drastically as you're stopping the treatment and doing your temperature measurement. So you're not having the most optimal maintenance and extension of 43 degrees C, as you're having the temperature fluctuate up and down as you start treatment and stop treatment to do your temperature measurement. And second, having to re-rise and re-elevate the temperature, and when you go back to start heating after doing your temperature measurement, is very painful to the patient. So what have we done in order to master the ability to extend 43 degrees C for the longest period of time, giving us the most optimal denaturization and thus the most optimal collaneogenesis and collagen contraction, aka remodeling? We have developed ACE technology, which stands for acquire a temperature, control a temperature, and extend a temperature, which is our fancy patented terminology to saying we have a thermometer built in our applicator. And our thermometer is measuring temperature simultaneously as we heat the tissue. And we don't expect the physician to have to be focusing on their treatment and also turning their head to check the temperature on the screen of the in-mode machine, because we've built in audible tone communication. As you first start to hit the patient's skin, the patient's skin typically starts to be around 25 to 30 degrees C, whether they run cold or hot respectively. And that correlates to a single beep. So you hear the machine beep, beep, beep. When you get 2 degrees Celsius away from the cutoff temperature, which you set on the machine, the device transitions into a double beep, a higher frequency pitch beep, 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 beep. And when you get to the cutoff temperature, the device actually makes its highest frequency triple beep, 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 beep. And that is actually the machine turning the power source off when you've hit your desired safe and effective temperature of 43 degrees C. And the minute you move over to neighboring tissue within the vector zone of treatment that you are conducting, the machine will actually filter the power right back on immediately, very rapidly, because the machine is measuring temperature every 1,000 cycles per second. Another benefit of our thermostat that we have built in the device via ACE technology is that you have the ability to diversify your cutoff temperature and change that depending on the patient's skin that you're treating. For example, if someone had a nice, thick, healthy dermis, you would max out at the 43 degrees C. But for example, if you had a, say, 62-year-old female patient, aged female patient with a thin skin, you would be able to go down, for example, to 41 degrees C. This allows for us to be able to really tailor our treatments to the patient's needs and what temperature is safe and effective to tissue tighten their dermis. Here you can see a FLIR camera thermal imaging profile showing nice uniform heat, as you would see with most moving technologies. But the difference between our FLIR camera thermal imaging profile compared to other moving technologies is that we get a much deeper uniform heating because we never have to stop our treatment. We can continue to heat as long as we need to within that vector zone of treatment. And understand that ACE technology is not just a safety feature. It is a safety feature that correlates to superior efficacy and consistent results for your patients, because we are able to bulk heat the longest, extend our heat the longest, to get the most optimal denaturization and thus the most optimal new collagen growth and remodeling, unparalleled to any other skin tightening technology that's hit the market. In terms of the physicality of the handpiece, it has a very ergonomic design. It's very lightweight. You can sort of hold it like a pencil. We have the ability to treat face and body. We have contact monitoring, which allows for us to prevent anti-arcing. And arcing is basically when you don't have proper uniform contact of the skin with the handpiece, rather than those electrical RF currents going down deep at the specific depths that we've designed within our physics array, the currents will instead go over the skin and take a chunk of skin out, which we call an arc burn. But what we've done to prevent that is we've built in anti-arcing software. If the handpiece does not have proper uniform contact to the tissue, it'll make an ant noise and shut the power off, so you do not have to worry about any type of arc burn with this technology. Again, our depths for the FormaFace application is 2.5 to 4 millimeters. whereas with a larger footprint and thus further distances between positive and negative, we get a deeper depth with the FormaPlus body applicator at 4.5 to 6 millimeters. We actually did a clinical study on 40 consecutive patients treated and evaluated what the collaneogenesis, aka collagen synthesis, was, and we showed that it actually increased to 13.7%. Also, you would expect, and sometimes it can be confusing, but ultimately, if you got good collagen contraction around new collagen growth, you would expect your dermis to become more compact and tighter. And so you'd expect the dermal thickness to actually reduce. And you can see it actually reduced from 1646 to 1452.8 microns. Here you can actually see a pre and post punch biopsy histology exam. On the left-hand side, you can see that it's spaced out and chaotic with the collagen design as the dermis is aged and the collagen fibers have stretched out, created elastic whorls. In the right, you can see a nice uniform organization. You can clearly see that there is new collagen and that it has remodeling of collagen fibers that existed around, making the tissue overall more compact in its appearance.